Imagine a life where every breath is a struggle, where the simple act of walking across a room leaves you gasping for air. This is the reality for millions living with chronic obstructive pulmonary disease, or COPD. It's a chronic lung disease that obstructs airflow from the lungs, making breathing incredibly difficult. Patients often describe it as feeling like they are breathing through a straw. This invisible struggle affects every aspect of their lives, from daily tasks to social interactions. The feeling of breathlessness can be terrifying, leading to anxiety and panic. This constant fight for air can take a toll not just physically, but emotionally as well. Living with COPD is a daily challenge, but knowledge and understanding can empower patients to manage their condition and live fulfilling lives. COPD is an umbrella term, encompassing several respiratory conditions that hinder lung function. The most common types include emphysema and chronic bronchitis. Emphysema destroys the tiny air sacs in our lungs, called alveoli, responsible for exchanging oxygen and carbon dioxide. Chronic bronchitis, on the other hand, causes inflammation and excess mucus production in the airways, making it hard to breathe. The primary culprit behind COPD is prolonged exposure to irritants that damage the lungs and airways. Smoking is by far the leading cause, responsible for nearly 80% of COPD cases. However, other factors like exposure to secondhand smoke, air pollution, chemical fumes and dust can also contribute to the development of this debilitating disease. While smoking remains the most significant risk factor, COPD can affect anyone. Those with a history of childhood respiratory infections, asthma, or genetic predisposition to lung diseases are at an increased risk. Additionally, people working in environments with high exposure to dust, fumes, and chemicals are also more susceptible. Age is another crucial factor, as COPD typically develops slowly over time, with most diagnoses occurring in people over the age of 40. However, it's important to note that COPD is not a normal part of aging. It's a serious condition that requires medical attention and management. COPD often progresses silently in its early stages, with symptoms appearing gradually over time. The most common warning sign is shortness of breath, especially during physical activities. This breathlessness tends to worsen over time, eventually interfering with even simple tasks. Other symptoms include persistent coughing, often accompanied by mucus production, wheezing, chest tightness, and frequent respiratory infections. As the disease progresses, individuals may experience fatigue, weight loss, and swelling in the legs, ankles, or feet. Early detection is crucial for slowing down the progression of COPD and managing its symptoms effectively. Section 5. Unraveling the mystery diagnosing COPD. Diagnosing COPD begins with a thorough medical history review and physical examination. Your doctor will ask about your symptoms, smoking history, and exposure to environmental irritants. The next step usually involves a simple breathing test called spirometry. This test measures how much air you can inhale and exhale and how quickly you can exhale. Depending on your symptoms and spirometry results, your doctor might recommend additional tests. Chest X-rays can help rule out other lung conditions, while arterial blood gas tests measure the oxygen and carbon dioxide levels in your blood. These tests help confirm the diagnosis and determine the severity of your COPD. Section 6. Navigating treatment, a multifaceted approach. While there is currently no cure for COPD, a variety of treatment options can help manage the symptoms and slow down the progression of the disease. The first and most crucial step for smokers is to quit smoking. Quitting smoking is the single most effective way to slow down lung damage and improve breathing. Treatment typically involves a combination of lifestyle modifications, medications, and pulmonary rehabilitation. Medications like bronchodilators and inhaled steroids help open up the airways and reduce inflammation. Pulmonary rehabilitation programs combine exercise, education, and breathing techniques to improve lung function and quality of life. Section 7. The invisible struggle, mental health, and COPD. Living with a chronic illness like COPD can take a toll on mental health. The constant struggle to breathe, limitations on daily activities, and the progressive nature of the disease can lead to feelings of anxiety, depression, and social isolation. It's crucial for individuals with COPD to recognize and address these emotional challenges. Support groups and counseling can provide a safe space for individuals to share their experiences, learn coping strategies, and connect with others facing similar challenges. Mental health professionals can help address anxiety and depression, improving overall well-being and quality of life for people with COPD. Section 8. A global epidemic, the burden of COPD. COPD is a global health crisis, affecting millions worldwide. According to the World Health Organization, COPD is the third leading cause of death globally, claiming over 3 million lives each year. The burden of COPD is particularly high in low and middle-income countries, where access to healthcare and diagnosis rates are lower. The economic impact of COPD is significant, costing healthcare systems billions of dollars annually. These costs include hospitalizations, doctor visits, medications, and lost productivity. Raising awareness about COPD, its risk factors, and the importance of early detection is crucial to combating this global epidemic. Section 9. Breathing easier. Living well with COPD. Receiving a COPD diagnosis can be overwhelming, but it's essential to remember that life doesn't end with a diagnosis. While COPD is a serious condition, with the right management and support, individuals can live full and active lives. Early detection and treatment are paramount in slowing down the progression of the disease and minimizing its impact on daily life. By understanding your condition, working closely with your healthcare team, and adopting healthy lifestyle habits, you can breathe easier and live a fulfilling life. Remember, knowledge is power, and taking an active role in managing your COPD can make a world of difference in your quality of life.